some abdominal pain, watery, non-bloody diarrhea, and it's generally self-limiting, usually resolves within a few days. Remember that the heat labile toxin is similar to the cholera toxin, while the heat stable toxin is similar to the Yersinia enterocolitica toxin. EPEC, or enteropathogenic E. coli, rarely can produce a Shiga-like toxin, but often does not produce any toxin at all. Instead, its mechanism of pathogenesis is that it adheres to the intestinal mucosa. So here's our intestinal mucosa, here's our adherent EPEC. Now, it causes effacement or flattening of the villi and also causes inflammation, both of which decrease absorption and cause diarrhea, especially in children. Remember, P for pediatrics. EHEC, or enterohemorrhagic E. coli, of which O157H7 is the most common serotype, also produces a Shiga-like toxin. It causes swelling of the endothelium and narrowing of blood vessels. Do you remember what the Shiga toxin does? It inactivates the 60S ribosome subunit inhibiting protein synthesis. This is what causes the hemolysis and platelet consumption, as well as reduced renal blood flow, and it leads ultimately to hemolytic uremic syndrome, or HUS. And what was the classic triad of HUS? Remember, anemia, thrombocytopenia, and acute renal failure. When you learn about thrombotic thrombocytopenic purpura in hematology, compare the symptoms of that disease to HUS, since they're very similar. EHEC can be differentiated from other E. coli by its inability to ferment.